Good morning, everyone. Thanks for joining us. It's going to be a cold weekend. I know that you all enjoy my weather forecasting. I think for clarification, the county government, like anyone else, can obviously just turn on the news and watch the weather. We also get a regular status report that is provided to the Department of Public Works and the Department of Emergency Response. We like to share that from time to time. I know that in Excites and Insights comments on our Facebook posts, but nevertheless, it's going to be a cold next couple of days with tomorrow, late this evening into and through tomorrow, with the wind chill or feel-like temperature being well below zero. So we want you to be safe, and to the extent that you can, please check in on your neighbor. Maybe an individual might be homebound or somebody who has particular challenges. You may just want to check in over the next couple of days and make sure that everything is okay. It's going to be a cold weekend, but let's get right to some of our data points and some updates. I do want to say this. We talked a little bit about this last week and the week before. We're in a transition period. There's some of us who think we should be transitioning faster. There's some who think we should be transitioning slower. But we are at a point now where the policies that are starting to come back down at us, and some are being forced, some are being decided, and some are simply the reality. There's an expectation that people are going to use the information you have, assess the risk, and make decisions for yourselves. And, I've said this for a while. It's come with criticism. It's come with support. At the end of the day, we are, however, in a point now where whether it's the end of contact tracing or how we manage, in quotes, isolation and quarantine, or who is in close contact, because this particular variant is so widespread and transmissibility is so great, with a significant degree less severity, and that's not to say that people aren't contracting COVID and aren't getting ill. They still are. But because of the nature of what we're dealing with at this point, wider transmissibility, larger transmissibility, less severity, we're at a position where we are transitioning from emergency to an enduring situation. And that enduring situation means you know what to do if you're sick, and you're going to see, I think, we're, again, either by choice or by design or by force, this changing of policy. Again, the end of contact tracing is one thing, and that is going to alter the way in which people, monitor the transmissibility. Over-the-counter access to over-the-counter testing, so that you can assess yourself. We've been putting a lot of pressure. Dr. Santiago has been asking the state government. I've been certainly calling for more investment in broad access to therapeutics and treatment, so that you and I could minimize the severity of this particular virus and have access to medical treatment. All of those things happening very rapidly at this point. I want to talk a little bit about what that looks like, the Dutchess County's website, to the dashboard, to how we're managing cases, and to what you'll be seeing and will want to see as we move forward in the days, weeks, and months ahead. We are currently monitoring 5,484 active cases, and 182 individuals are in hospitals in Dutchess County with a positive confirmation of COVID-19. So this is the fourth day of decline in active cases in Dutchess County. Now, there are two things that have caused that to happen. Number one, we are seeing a slowing in the new cases coming to us, and we expected this. We talked about this before. Again, we've said it coming into the winter months. We expected coming into the holidays that we would see this acceleration of cases. Perhaps not as severe and as many as we've seen, but we knew that we were going to start seeing cases again. That has begun to slow. And that is promising, and not yet a trend, but promising information. The second is both the state and the CDC, so State Department of Health, CDC, has altered the quarantining requirements, and so active cases end at 5 days. So if you test positive on January 1st, 5 days later, you are then removed from the active case list for us. And that those two things combined have provided a reduction in the number of active cases. But we are seeing a slowing in the number of active cases, new cases coming to us every day, which is positive news. Not yet something that we can say is an absolute trend, but it's definitely promising, definitely positive. Second, we have converted from the 10-day quarantine requirement, which would make you an active case for 10 days, to 5 days. And remember, the CDC and the state say regardless of vaccination status, the quarantine requirement is 5 days. At the end of those 5 days, you are no longer considered an active case and therefore removed from the dashboard. And we think that that is important, one, to explain to you, but also it's now the change in the way the policy functions. So we can't necessarily say today, Dutchess County saw 2,000 fewer cases. That isn't the case. We're seeing a slowing in new cases coming at us, the reduction in the number of active cases because of the quarantine change, and in the days and weeks ahead. So when we get together next week, we'll be able to give a more accurate picture of what's occurring now day to day. So the 5,344 becomes today's base. Moving forward, are we going to have 5,800 or are we going to have 4,900? And where are we this time next week? And we'll talk about that when we get there next week, but I wanted to explain that part to you. So we'll continue to monitor those active cases using now this new standard, which is the 5-day quarantine requirement, no longer active on day 6, first 5 days active cases. But again, to reiterate, we are seeing a slowing in the total number of new cases coming at us per day, or day over day, and averaging out over time. Over the last month, from December 12th to January 8th, the largest number of new cases are coming to us in the 20 to 29 years of age grouping. That's 19% of new cases. Those who are 30 to 39 years of age represent 17% of new cases. The county is averaging 3,711 tests daily in the last 7 days. That does not include the over-the-counter take-home tests. And so that's another variable that is changing the way we can evaluate where we are with data. But again, having an at-home test means if you don't feel well, take the test. And then you determine what to do with that information. Of course, there's an isolation requirement if you test positive. But again, the goal here, and certainly it's our expectation, is we give you the tools and you make choices that are in your best interest, in the interest of those you care for, and to hope to some extent your neighbors. So 3,711 tests per day administered in the county does not include the over-the-counter test kits. 42,000 tests were conducted in Dutchess County by health professionals since the beginning of this year. So in December, I think we conducted something like 86,000 tests over the month of December. We're at 42,000 tests this year administered for consideration. It gives us those tests give us information, and that information helps us to inform you and to make choices in our own lives. We're averaging 816 new cases daily, and this is over the last 7 days. We have seen a bit of a decline. You'll see the higher numbers 5 days ago, lower numbers 4, 3, 2 days ago. So we are monitoring that, and again, not a trend. Maybe next week we'll be able to say that. But we do think that we are definitely moving in the right direction. The other is public health officials, the governor, and of course I said this a couple weeks ago, not without a share of criticism, but we are nearing what we think is the peak. If you look at this particular variant and where other countries and other parts of the country has been ahead of us, it seems as if this particular wave has peaked in other places 2 to 3 weeks ago based on the same basic variables that we're dealing with. And we think that the Mid-Hudson, New York City, Long Island region is very close, if not at peak. And again, we'll know more and be able to talk more about that next week. Now, I do also want to say, and we talked about this, we've talked about this for 20 months. I mentioned this last week. It is also, and it has been true, that those communities along the Metro North, Long Island Railroad, MTA rail line, so close proximity with direct transportation connectivity to densely populated metropolitan areas like New York City, we have seen cases emanate from those locations outward. If you remember months and months ago, if there was a map of the region that went from red, meaning high number, high density of cases, to let's say yellow or green, low number, low density of cases, you could almost see the red along the rail lines, the red in and around New York City, and then that gradient would dissipate as you left from those rail lines. Ulster County, as an example, is starting to see and has been seeing a ramping up of cases. That is likely, again, the slow progression of this particular wave from those transportation lines, urban centers, more densely populated communities outward. And we experienced this for nearly 2 years now. Well, actually, it is 2 years now, and we're starting to see it now. So there are other parts of the region that are probably a week or two still before peak. We think, and again, this is not Dutchess County saying it, we think health professionals, the governor, and others have pointed to the possibility that we are either at or very near peak in this particular wave. And we'll know more and be able to talk more about that when we get together again a week from now. So Dr. Santiago, the Commissioner of the Department of Health, spoke about this in the video she provided regarding the positivity rate, which gets us to one of the questions that I know that residents have been asking about both the positivity rate and the metric, the other metric of new cases per 100,000. You can get a positivity rate for the county and the region through the New York State dashboard. You can visit that anytime you want. Neither the state nor the CDC believes that positivity rate is an effective tool any longer. It has always been a fairly weak data point, but because we were able to monitor it using the same math, the same variables for a period of time, at least over history, over time, we were able to see, positivity rate versus a year ago versus a month ago. The variables have changed now. One, we know more about the virus. There are ways that we have seen its mutation, and you have tools to assess your own positivity. Test kits. So positivity rate has been the number of positive cases today divided by the number of total tests today. And so with that, you take the denominator, the total number of tests today, you divide that into the total number of positives, you get a positivity rate. Well, if all of a sudden, a couple things. One variable is, when do those positive tests come in? If they're coming in a timely fashion, you're getting a bit of information. We got tested 2 days ago and we get the positive case today. That at least is legitimate. Backed up labs, and we talked about this early on in the pandemic, backed up labs or not access to testing, you could prolong that number and we could be doing the math on a positive case today that was 2 weeks ago. Second, the denominator, the bottom of that equation, right? The total test number. That changes. Early on in the pandemic, very little access to testing, and we had to prop up test sites, etc. When there are too few access points, that number is relatively meaningless. Now there are too many access points. Not too many, I shouldn't say it that way. There are many access points. You're getting a test at home through your own means. You may be getting tests from a physician or someone else, and I don't know. I shouldn't say that. In the case of physicians, they're being reported. But if you're doing a take-home test, that number gets taken out of the denominator, and therefore the positivity rate becomes relatively meaningless from a public health perspective, and it isn't terribly useful. So you're not evaluating the same apples and apples, if you will. You're looking at apples and oranges. So Dr. Santiago talked a little bit about that. We're replacing the positivity rate on the county dashboard at dutchessny.gov. We're replacing the positivity rate, which is a truly meaningless data point at this point, with new cases per 100,000. And this is a number that the state is increasingly pointing to, and it's a good enough number because it can show for us a trend, right? We can look at over time, and we're able to do this historically. We can see the total number of new cases per day. We can see, are they up, are they down? And that particular number in real time can advise us on the potential for hospitalizations and where we are. And so that number in that particular data point, positivity rate, is being replaced with the new cases per 100,000. You'll see that now on the dashboard. And the other, of course, is to point out that even if you are taking an at-home test, one, You may not be reporting a positive case. You may be just simply choosing to take the precautionary steps yourself. So you're never going to be in the dash. You're never going to be in a public health data. Or if you test negative, you're not likely to report it at all. So that number becomes much, much less useful. In fact, it becomes almost meaningless, and therefore the transition on the webpage is to give us a more accurate picture of where we are in both transmission and public health concern in the community. 556 individuals, of our friends, family, and neighbors have lost their life to this particular virus. We continue to extend our prayers, thoughts to those families who live on with loss. We are, as I said, we've been monitoring hospitalizations. The Mid-Hudson region has been holding its own on capacity. That's not to say that we haven't been concerned. It's just we haven't reached an alarming state yet. And we're hopeful that we start to begin to see a trend in a decline in hospitalizations. The hospital demographics averaged over the last 2 weeks 118 patients on average. 61% of those who have been hospitalized are either partially or not vaccinated at all. Again, I've said this many times. It's not a judgment, not passing judgment, simply passing on the information so it's useful. 61% of those who have been hospitalized are vaccinated. 39% of those who are hospitalized, I said that wrong, 61% of those who have been hospitalized are not vaccinated. I don't know if I got that correct, are not vaccinated. 39% of those hospitalized are vaccinated on average. And we continue to know this, that the most severe cases of hospitalization are among individuals with significant comorbidities. So you know if you have a significant public health, personal health risk, you clearly are more susceptible to this particular virus, and you want to take steps to protect yourself. And we know that through the hospitalization data and through the science and our understanding of this particular virus. On average, 1.5% of those hospitalized are below 18 years of age, or 18 and younger. 15.8% of those hospitalized are 19 to 44 years of age. 30% of those hospitalized are 45 to 64, and 52.6% are above the age of 65. Vaccination data continues to increase. 83.6% of adults in Dutchess County have received at least their first dose, with 74.7, basically 75% of the total population having begun vaccination. Those who are 5 to 11 years of age, we're seeing a 28.2% vaccination rate, and 12 to 17-year-olds are vaccinated at 66.5%, both slightly below the state average. But again, we encourage you to make those choices, to talk to your physician and get some questions answered, and to make those choices with your children and physician. Positivity rate, as I said, no longer going to appear on the dashboard, so we've replaced that now with this new case per 100,000. You'll see that as well. Want to remind you that we continue to provide clinic opportunities in the county. Our JCPenney's location at the Poughkeepsie Galleria. This is we're now open for vaccinations every Tuesday from 4 to 7 p.m., every Thursday from 4 to 7 p.m., and on Saturdays from 9 to 12 p.m. at the JCPenney's location at the Poughkeepsie Galleria. You can walk in or pre-register. We prefer if you pre-register. You can do that at dutchessny.gov/COVID vaccine for more information. As far as testing, we continue to increase testing opportunities. I know there's folks who want to be tested, don't want to be tested. We should test, we shouldn't test. At the end of the day, we want the availability for you to make the decisions that you feel are best for yourself. And so testing continues at the JCPenney's location. So upstairs, the second floor of the JCPenney's, former JCPenney's, at the entrance next to the Best Buy, we've expanded hours and capacity. The state of New York has come through with their support of additional staffing. So, by the way, if you're paying attention to other opportunities, the state has opened, I think last week, opened a testing location in Ulster County. Dutchess County's testing location has been open since, well, it's been open for as long as we can remember, but at this point, but it's been open for months in order to get to full capacity. the state, as they did in Ulster, they staff the entire thing, right, to get to full capacity. In Dutchess, they're providing us some resources to get to full capacity. So we both have basically the same asset, full capacity, open, available for testing. We are now 5 days a week, Tuesday through Friday, 1 to 7 p.m., and Saturdays from 9 a.m. To 1 p.m. Just as we mentioned, we have had previously delays in lab results. We know that. We had a one particular day over the last 3 weeks, which was significantly problematic. The health department went right to work. I want to commend Commissioner Santiago, Assistant Commissioner Anthony Ruggiero, Rachel Cashmere from my office, and others who really dove into it to try to make sure that we could remedy that situation. We have transitioned to other labs, and the staff resource on site is doing a tremendous job. So if you've experienced some delays in the last few days, please do let us know. But we are seeing both capacities increase, the flow has been going well, and test results are coming in much more consistently, and that's important. We get questions, and I know that you've asked this both here and before. Where do you get over-the-counter test kits? So in partnership with the state of New York, school districts, and towns, villages, and cities around the county, we've distributed over 70,000 test kits these last 3 weeks. That's a significant amount of over-the-counter test kits. And the latest shipment of test kits from New York State were targeted to licensed congregate facilities, so nursing homes and schools. So that was the last shipment that came out that we distributed last week. We expect another shipment the state will make available along with a supplemental supply that we'll be making available. As soon as those are available, we'll be informing the municipalities for distribution, and you should be looking for that in the next several days. We expect that there'll be expanded opportunity. We hope as soon as in the next couple of weeks. It really is based on when the supply comes in, but we're prepared certainly to distribute more. And I do want to offer two things. One, to commend the towns, villages, and cities. They were asked to step up very quickly. I know it wasn't easy. I know they didn't come without some consternation, but town supervisors, village mayors, city mayors have all tried to take on this task of making test kits available to those who want them in your community. In order to ensure equitable distribution, the goal was to apportion these based on population, based on the total numbers we've had. And so, yes, if you were a smaller population, you received same proportion, but a small number. But nevertheless, thousands upon thousands of test kits administered by local municipalities in partnership with maybe their fire departments or their police agencies or public works, the town clerk, others. Very, very grateful for the work that they've been doing. We hope that this will slow up soon, but we're looking at another few weeks of a test kit distribution. Secondly, I want to acknowledge our school districts. Dutchess County was the first in the region to implement test to stay. Our goal has been to keep kids in school, period. Keep kids in school. Do not close schools. Do not go to remote unless absolutely necessary. Do not substitute virtual for in-person care, in particular for special education. We've made this case for months. We've been arguing this as loudly as we can. Kids need to be in the classroom safely. Teachers need to be able to have that connection, and in particular those kids with IEPs, special education services. We cannot allow the regression and the isolation that they've experienced. And because of the Test to Stay initiative, we've been keeping hundreds of kids in school over the course of the last several months. New York State implemented Test to Stay a couple weeks ago. We've been doing this since end of October last year. Thankful to the school superintendents. It's been this massive transitionary period. Information is coming out very quickly. Whatever we say today is likely to be altered slightly tomorrow, but they've been trying to keep up with the Test to Stay initiative, and we're grateful these last several weeks in getting those kits out and giving the access to residents, to students and faculty as well. So you probably heard a little bit about a change in contact tracing. For all intents and purposes, contact tracing has ended. The state of New York announced this a couple days ago. The governor basically said she said contact tracing is not going to continue. That was basically acknowledging what had been occurring. So the county continues targeted contact tracing. What does that mean? That means if you are a member of the general public and you test positive, you should not expect to receive any communication from the health department. If there's a flare-up in a congregate care facility, assisted living facility, independent living facility, if it's a flare-up in a school building, there would be contact tracing. But for general public, general positive cases, this is becoming very much like the neurovirus. If your child is in a class where a student may have contracted neurovirus, you may receive an email that says someone in your class has the neurovirus. Watch your symptoms. If you're not feeling well, stay in, and obviously visit a physician. We are, from a contact tracing perspective, transitioning to that. And what that means is that there's not a formalized effort to identify contacts. If you know somebody who's tested positive, and you've come into contact with them, or they've told you that they're sick, you want to monitor your symptoms, see if you have any, monitor your health, visit a physician, get a test. But there is not going to be formal contact tracing. Now you might say, well, that seems strange. With so many cases, isn't it more important now than ever? The answer is no. Because of the widespread transmissibility and because of the overall less severity, again, not that this isn't severe for certain people, it certainly is, but because of widespread transmissibility, contact tracing is not an effective tool any longer to be able to slow transmission. So again, from the state's perspective, not happening. We, of course, will continue it only in those areas that I mentioned, sort of where there's close contact, where we could potentially affect transmission in a particular congregate care or shared living environment. That makes sense, but broadly, no, there's no effort to identify those contacts. The state has launched its a new isolation and quarantine a survey, if you will. It's an online affirmation. Basically, you can assert that you are a contact, and then it's a PDF online that you can fill out, and it has some frequently asked questions attached to it. So you go through that process if you're a contact, and you'll get a State Department of Health isolation order. But if you don't go through that process, there is no, you should not expect communication from the health department, any health department, telling you that you are a contact. Now, again, if you have been in close contact, close proximity, you want to monitor your health, you want to see if you have any symptoms, and you want to visit a physician and/or take a test to confirm your own health. And that said, I just would offer. This goes hand in hand with the change in the isolation and the quarantine requirements. Remember, we were at once 14, 10, 5 days, and so really we're at a point where our transitioning to, and I said this at the beginning, transitioning to, and I believe we have to be, where you're going to, you know what you need to do. You're going to be told what information there is, and you're going to have to make smart and important choices to keep yourself healthy. The institutions like school districts and others are going to catch up with the change in policy, but give them a little bit of time. And I think we kind of explained today, I hope, with as much detail where we are. Now, I know one question's come up, accessing masks. If you are interested in accessing masks, we've distributed. Okay, another question came up. We've distributed over 100,000 masks to municipalities. You can reach out to your town, village, or city if they have them available. Certainly, they are to make them available to residents. And when and if there are additional KN95s for distribution, we'll make sure that we get them out into the community. But that is where you would find them. Debs asked, why aren't there mass vaccination sites for boosters open daily? The short answer is, unlike early in the pandemic, there is access to vaccinations. You have mass vaccination points when you need to move people, a mass number of people, to singular locations to get a vaccine. Vaccine for individuals are relatively accessible through your physician, through a health clinic. Dutchess County partners with Sun River Health as a federal health clinic for those who might have financial concerns. And of course, we are doing them 3 days a week, at the J.C. Penney's location. We'll have a few more remote pop-up opportunities that are becoming available, but because of general access, there is accessibility for you to get to a booster shot or vaccine. And so there are not the resources being made available by the state or federal government for that purpose. And we just encourage you to find your way. If you've chosen to be vaccinated, we encourage you to find your way to your physician and/or one of our clinics for access to that. That's where we are with vaccinations, and appreciate the question. So. Again, change in both policy and practice is resulting in fewer days of isolation. Therefore, active cases, a total number of active cases, you saw a steep decline. We are also seeing a slowing in the total number of new cases per day. On the county dashboard, you see a transition from the positivity rate to total new cases per day. The active number of cases will be more information, will be more informative to us 7 days from now, meaning when we get together next week, we'll see where we are based on the new quarantine requirements and the reduction in that active number of cases. But those two things combined are showing what we hope will become a trend. As I said, there will be opportunity for test kit distribution. We expect the state will make that available, distribution available in the days ahead, and in the coming weeks there'll be greater opportunity for you to access over-the-counter test kits as well. With that, in the meantime, stay warm this weekend. It's going to be brutally cold. It is winter, so we should come to expect it. But check in on a neighbor who might be isolated, homebound, may need assistance. If you have an emergency, please, as always, a true emergency, dial 911. Dutchess County Emergency Response Dispatchers are there to be of help. And in the meantime, be safe, stay healthy, and be kind to each other.